Tarantine, and this is Advocate Today. The Red Cross has altered its blood donation policy to allow more gay men to give. The organization's previous policies banned most gay men from donating blood regardless of their health. That was in line with rules set by the Food and Drug Administration. The FDA changed those rules back in May to rely more on screening questions about specific behaviors and medications to reduce the risk of transmitting HIV. Now, the Red Cross has officially adopted those changes and put them into practice. The American Red Cross supplies about 40% of the blood supply in the U.S. There will be a new head of the National Institute of Allergy and Infectious Diseases, a position previously held by Dr. Anthony Fauci, and she's the first queer person to hold the post. Dr. Jeanne Marrazzo will take over this fall. Fauci retired back in December. Dr. Marrazzo is a lesbian and is known for being an expert on STIs and also on her research regarding contraceptives and reproductive health. She is currently the director of infectious diseases at the University of Alabama at Birmingham. The discriminatory and illegal practices of redlining goes back decades in America. It disenfranchises black people by creating barriers to home ownership. It was outlawed by the Fair Housing Act of 1968, but much of America is still divided along the same lines created by redlining. Now, a new study is showing the impacts of redlining on heart health. I sat down with the doctor who authorized this study to discuss his findings and what we can learn from them. Ambrish, thank you so much for joining us today. How are you?
I'm doing well. Thank you for having me here. Excited to be on this platform and talk to you more about this important topic that we have been really interested in and doing some work in.
Yeah, so I'm interested. How did this all come to be for you to research heart health disparities, particularly among Black Americans? What are the specific findings on redlining and its impacts on heart health in the Black community?
Yeah, so I think that this question was the central, uh, piece of our work that was recently published in Circulation, where we looked at the association of redlining as a measure of structural racism, which was in practice in the 1930s, and how even now it impacts the risk of heart failure among Medicare beneficiaries. So basically, redlining refers to a discriminatory housing policy that was effectively outlawed nearly half a century ago. But in this study, what we found was that areas where historical redlining was practiced and areas that were identified as redlined areas based on this policy, there's still a higher risk of heart failure development among Black adults who are living in those areas, suggesting that some of the adverse impacts of this discriminatory policy have still persisted, and a lot of that adverse impact have been driven by higher burden of adverse social determinants of health among these individuals who live in these red line areas.
Higher levels of socioeconomic distress can explain approximately half of the excess heart failures among Black adults in redline communities. Can you kind of elaborate on the factors contributing to this socioeconomic distress when it comes to heart health?
Yeah, so I think just to give you a brief context, so redlining was associated with adverse outcomes and high risk of heart failure in our study, more so among Black adults. And a lot of this risk was mediated by a high burden of adverse social determinants of health among these patients who were living in redlined areas. I think it kind of highlights that because of the redlining policy, there has been less investment from a societal standpoint and from growth of the neighborhood standpoint in these areas. And owing to that, these areas are exposed to higher burden of adverse social determinants of health, including poor neighborhood, lower income, lower access to healthy uh, communities in terms of access to exercise areas or healthy food avenues, and all that translates into increased risk of developing heart failure in these patients who live in these redlined areas.
And what are some potential interventions or policy measures that you believe from the work that you're doing can kind of address all of this?
I think it's really important to address the adverse social determinants of health burden among individuals who live in these areas that have been identified as redline in the past. And I think we have, as a society, not done enough to invest in these areas and improve the living conditions and improve the opportunities to have access to healthy living. And I think so changes are needed from a policy standpoint and from investment of our efforts to improve the social determinants of health in these regions and improve access to care in these regions, so that individuals living in these areas can have better chance at healthy living, and that will translate into lower risk of cardiovascular disease, including heart failure in these areas.
And do you think there are any other historical or systematic factors contributing to this disparity? And what can policymakers and healthcare providers do to, address it?
I think structural racism has been prevalent in our society, and that has contributed to differential access to care and differential, I think, risk of heart disease and other medical conditions among patients of self-reported Black race and other ethnic or socioeconomic uh, disadvantaged backgrounds. And I think a lot of onus is on the policymakers to improve access to care and consciously invest more in improving the living conditions and the social determinants of health in these regions, so that the residents of these regions have better access to healthy living and better access to better food and healthcare, so as to improve the long-term risk of cardiovascular disease.
Thank you so much for sharing this information on this very, very important topic and how it impacts specific communities. We really do appreciate it. Thank you.
Thank you.
We recently spoke to Dr. Durán, an educator and the superintendent of Arlington Public Schools in Virginia. He responded to the state's new policies on how to treat trans students by saying every student counts. Dr. Durán is offering some advice to educators who are being silenced on diversity and inclusion topics in school. And what is your message to, an educator out there who may be watching this, who may be, working in a school system where, they are kind of cracking down on diversity and inclusion standards? What encouragement do you have for them?
Well, I would say continue to stay focused on why you chose to be an educator. Remind yourself, most people come into education because we want to help and support kids. And so stay focused on that. And remember, as I said a minute ago, students really are supporting each other. So find a way to stay out of the politics of it all. Find a way to just reach out and welcome your students when they come into your classroom each day. Find a way to make them feel safe in your room. As an educator, you can't control all of the school system. You can't control perhaps even your own school, but you have control over your classroom and the four walls within your classroom and what goes on there. So make sure that what you're doing each and every day when students walk in and sit down in the desks in your room, that you are staying true to why you wanted to be there in the first place. And that is to help them be successful. And so sometimes that might mean just making the safe space for them, making them feel welcome and warm, and focusing on their academics so that they can be successful. And when other types of things happen that are they're discriminatory or students aren't feeling unsafe, just let them know, I'm here for you. I'm your teacher, and I'm here to make you learn and help you learn. And I'm going to do whatever it takes. So let me find out what I can do to help you be successful. Stay focused. That's what we're here for, to teach our students to learn and to make them feel safe. So if that's why you chose to go into education, which I believe most people did, then stay focused on that and away from all this other political dialogue that sometimes wants to distract us from the main core and the essence of what we should be doing each and every day. As I talk to students, by and large, in my school system, they're not the ones having concerns about some of these issues. They are there supporting their peers in great numbers. And so a lot of this stuff, unfortunately, becomes issues that the adults are having with regards to how we support our youth. When our youth are like, wait a minute, we're good. We let us be students and let us continue to learn. And at the end of the day, for me, all students should be worried about is doing their homework, being able to pass their tests, being able to advance in whatever content they're taking in the course. That's what they should be worried about. They should not be worried about whether they can come to school, go to the bathroom, not go to the bathroom, what sports they can play, who's going to welcome them, who's going to make them. That shouldn't be things a child has to worry about when they come to school. They should be focused on academics. And our job as educators, we shouldn't be get caught up in that either. We should be focused on just teaching all students who come to our school.
Thanks for watching Advocate Today. Download the app in the Apple or even the Google Play Store to stream us live, and you can even subscribe to our YouTube channel. I'm Aaron Dean, and this was Advocate Today.